Hi, I'm Dr. Campos from Mexicali Bariatric Center. One of the most frequently questions that we get asked is about staples. It's very important to talk about staples. The first thing is staples are disposable devices. That means that we don't reuse any staple or we don't re-sterilize any staple. They're disposable and they're made each one for each patient. That makes sense because basically it's like a regular office staple that you just fire it up and then it will come the little staple. The difference about a regular office staple and the surgical staples are very important. The first thing is they are made about titanium, which is less reactive on the body. Another question is, are the staples going to stay on my body always or forever? Yes, they are. The strength of the stomach is basically given because of the scarring tissue. The staples are meant to hold everything in place until your stomach creates scarring tissue around that staple line and protect it. But because they're very, very small and then there will be scarring tissue growing around the staple line, we cannot go after the surgery and take all the little staples away. That means that basically the staples will stay in your body. Don't worry, they don't set any metal detectors or they're gonna make you beep on the airport. You have little tiny titanium non-reactive staples. And the cartridge could be a 60 or a smaller cartridge. That's what we call a 45 or a 60. And it's the length of the disposable staple cartridge. Then each cartridge comes with 3 little lines of staples on each side. That's basically, you have 3 rows of the staples to have more protection and have less risk of a leakage. And then there comes a blade in the middle that will cut everything. And then 3 more rows, because the tissue that it's going to be removed or that it's going to be stay on the other side of the stomach needs to be stapled as well. The staples are used in basically gastric surgery like gastric sleeve, bypass, or duodenal switch. And we have different kinds of staple cartridge, and that's basically because we have different kinds of tissue. For example, we have a black cartridge on the Johnson & Johnson family, which is the Ethicon brand of the Johnson & Johnson. And the black cartridge is a more gird cartridge, it's a more thicker. When we have more thick tissue, for example, the bottom of the stomach or the lower part of the stomach, normally it's a little bit more thicker than the rest of the stomach. So this one, it can catch around 44 millimeters or 4.4 millimeters of tissue. Sounds very small tissue, but basically what we do is we squeeze the tissue, and remember, we're going to be stapling 2 sides of the stomach, one wall of the stomach and the other wall of the stomach, and we'll be creating a sandwich of the tissue in the middle, and then we'll staple that. There's something very important that we need to do when we're stapling, and it's basically locate the tissue that we're going to staple and then pull a little bit of tissue and then squeeze it, so the tissue is not going to be moving around or flowing around. And then the second thing is weight. That's quite important, because if we just close the stapler and then we fire it up, there's not enough time to move the water inside the tissue or the blood inside the tissue to the sides. So when we staple, that water will be basically giving more girth or more size of the tissue. So what we do is just squeeze it and wait. Normally we wait around 60 seconds until all the water and the blood flows around, and then we can fire it up. When we fire that tissue, we open the staple and remove it down. We're going to show some videos about how we do it and how in the surgical it's being done. Then the second kind of a staple or cartridge that we use is the green one, which is the 4.1, and normally is the one that we use for the antrum or the lower part of the stomach. So we normally begin with on the gastric sleeve, we began basically with the black one, and then we go with green ones, and then we have the 3.5, which is a little bit less in thickness is the blue, or probably is the most common staple cartridge, the blue one. So we normally use the blue one for the rest of the staple or the body. And then we have a white one, which is the 2.5. And this one basically it's used for intestine, or it's used for anastomosis. It's quite important that we choose the right staple for each tissue, because either we have more risk of leakage or we can have more risk of bleeding. So if we choose a very thick cartridge on a very thin tissue, we can have more bleeding, which is it could be a complication. It's very important as well to use brand name cartridge. We don't use any cartridge that is not brand name. It's quite important because all the standards and they're FDA approved, so the quality of the staples are very important on the surgery. Well, basically, how can you know if you're using a brand name or your surgeon is using a brand name? He can show you the kind of a staple. Either it could be Johnson & Johnson or Covidien or any other brand name. It comes with a serial number or a lot number. Normally it comes with a code that you can scan. Not because you will scan that code, but basically because you will know that they're using a brand name staple. Sometimes we have seen revisional surgery when we go to surgery and we see that there's only 2 or 3 staple part of the stomach. Sometimes some gastric sleeve, they have less staple tissue, and it's basically because the more staples that you use in the surgery, the more of the cost of the surgery could be. So lower cost surgery sometimes means less staples and more risk, or just using one kind of staplers. So what we advise is always ask your doctor about what kind of a staple they will use. Be aware that any counterfeit staples could be a problem, and then choose accordingly any brand name staples, or talk to your doctor about if he's using good quality products.